Good morning. It's Dr. Jeffreys again on Thy Precious Jewels Health Talk. Since last week, we've been discussing the issue of vaginal discharge. We did speak about candida and the symptoms you would have if you have candida. Today, I'll be talking about bacterial vaginosis. This is the commonest cause of vaginal discharge. It is an awful condition because it's really embarrassing for women who suffer it. The reason why it's embarrassing is because the discharge gives you a very fishy smell, very fishy odor, one that is very repulsive. Most clinicians will be able to diagnose your bacterial vaginosis from the minute you're walking through the door of their consulting room. That is how bad it can be. 1 in every 3 women will have symptoms of bacterial vaginosis, though in some people it may be more severe than others. Now, what causes BV? I did mention last week that we have few different types of bugs that live down below. Usually they know how they manage themselves and there is a balance in these bugs. However, for some reasons, when there is an imbalance and the proportion of bugs are not equal or what they're supposed to be, then you have a thriving group which now takes over down below, and that is what produces the fishy smell. The people who are more prone to this are people who have got a coil in their womb for the purpose of preventing a pregnancy. Also, people who wash down below excessively and people who smoke. Most people who suffer bacterial vaginosis notice that the discharge is a lot more after sex or in the days after their period. Bacterial vaginosis does not cause itching or soreness like thrush. So for a good number of the women, it is just the smell and the amount of discharge that you have that will let you know that there is something wrong. Now, how do you manage bacterial vaginosis? If you notice that you have this copious discharge from down below, and it smells as though you have had a fish stuck in your knickers, the best thing to do would be to go talk to a doctor. The reason for this being that, number 1, BV is not the only cause of vaginal discharge. It may be a totally different bug that's causing the symptom, or it may even be something more serious. When you get in to see your doctor, they will take a full history from you, asking you exactly all that I've mentioned about your symptoms, and then they may examine you. They may take a swab from down below, and when I say a swab, I mean they may take a little sample from the discharge that you have and send it off to the labs. Usually within 3 to 5 days, they should be able to get back to you and give you the results. If you have bacterial vaginosis, most times it sorts itself out when the balance is rectified. But for some people, they do need treatment. Some women who have had BV will find out that they continue to have it again and again. It may be that you need to maintain the balance down below, and there are a few things that you can get from the shops that will help you to maintain the pH, which is talking about the acidity of the vagina. There are lots of scary causes of vaginal discharge. BV is one that its bark is worse than its bite. It doesn't harm that badly, but it smells really awful, most especially if you're sexually active. It can be off-putting. We always advise that you get checked. Get treated if you need to. It is not a sexually transmitted infection. It is just due to how your body is working. If you have any questions about bacterial vaginosis or any other topics that we have dealt with on Thy Precious Jewels Health Talk, or any female medical problems at all, please drop a line, send us an email to thypreciousjewels@googlemail.com, and I or any one of my colleagues will be happy to deal with it for you. Thank you again for watching today. On behalf of Thy Precious Jewels UK, this is Dr. Omobola Jeffreys. Have a good morning.